again, this is Charles Felix from South Florida Hospital News. I want to welcome you to our continuing series of healthcare leadership conversation and video series. And today we are honored to have Dr. Joshua Lenchus with us from Broward Health. And before I go into anything more, welcome to our video and conversation.
Thank you for having me, Charles.
Can you tell us a little bit about, well, tell us your full name, because I didn't mess it up a little bit, but tell us your full name and your position over at Broward Health.
I'm Dr. Joshua Lenchus. I'm the Chief Medical Officer for Broward Health.
Great. And we'll get into your previous background, but tell us a little bit. A lot of people watching this are the people who are looking to excel within the healthcare industry, maybe residents, maybe other professionals, but they'll always like to know the educational background of the leadership within healthcare. Can you give us a little background on your education?
Yeah, I went to public high school here in Broward County, two different public high schools, in fact. I graduated and went to what was then called Broward Community College, where I spent several years before getting an associate in arts degree. Then I went to the University of Florida, where I completed my pharmacy training at their College of Pharmacy. I graduated as a pharmacist. I practiced for 3 years in a combination of retail pharmacy and hospital pharmacy. Then I went back to medical school at Nova Southeastern College of Osteopathic Medicine. I finished there, and then I was actually at Broward during my last 2 years in medical school, and for 1 year after that, before I completed my internal medicine training at Jackson Memorial in Miami. I was hired by the University of Miami as faculty, and I spent the better part of 14 years there as faculty before coming up here about 4 years ago now and taking the Chief Medical Officer position at Broward Health Medical Center. And then just recently did I take the full role.
Tell us a little bit about the challenges that you may have had during your different positions and move from Jackson to here, from a variety of different, as dealing as a pharmacist. What were some of the challenges that you could give advice to people as far as kind of as their career moves, not only from a physician standpoint, but as a business standpoint?
I think probably the biggest challenge is just how you manage and adapt to different environments and change. You know, everywhere that you go, you have different experiences, and that informs where you're going to go, where you are going to go next. And you should bring with you all of those experiences, the good and the bad, because it helps to inform where you're going to. So things that you've experienced that were not so good and that were opportunities for improvement, you may have crafted solutions for them, and you move to those new areas, bringing that those new pearls to that area. As well as the tremendous opportunity of networking. I think that's really the key to success in any field, but certainly in the medical field, is just the ability to connect with other people and really put yourself in their shoes, try to live through their experiences, because that's what informs their perspective. And in leadership, understanding the other person's perspective is an incredibly valuable characteristic.
Tell us, if you can, a couple of the mentors by name, or just, the types of people that they were to be able to get to where you are today.
Yeah, well, I guess it all started probably in high school. There was a chemistry teacher that I had who was a Vietnam vet who worked on napalm. And I thought that was fascinating. My dad is a vet from 3 different branches. And so I've always been kind of a military brat. And he started me off on the whole pharmacy aspect. I was fortunate to work through community college as a pharmacy technician at a hospital. So bonding with the pharmacists that I worked with there helped launch me into my pharmacy career. After I got out of pharmacy and I worked at a hospital as a pharmacist, I really got to know a number of the physicians out at where I was working at the time was Wellington Regional Medical Center up in West Palm Beach. And those guys really were tremendous advocates for me to continue to pursue my studies and enter medical school. In fact, they made phone calls and wrote letters of recommendation and again leveraged their contacts to get me in. So each aspect, I think, of my career, I've been incredibly fortunate to have found and learned from folks that have helped boost me up to get to the next step to where I am today.
Can you describe some of the challenges and those things that actually you learned through the COVID situation that you can apply today that make things better?
Yeah, I mean, that's really a profound question. COVID, I think during the whole pandemic, the word unprecedented has been used a lot of times. But if you think about it, really, the people that have dealt with this were not around in the 1918 influenza epidemic. So it really is unprecedented in that respect. Perhaps not from a historical perspective, but certainly how we deal with it. What was what was an incredible challenge, a real obstacle to us is in the medical profession today, we have encountered just about everything that there is to encounter. And we have some experience, whether our own or leveraging contexts that we have across our own community or across the world in an effort to try to better the care that we provide to patients. COVID upended all of that. There was frankly no guidance in the initial phases. Everybody was looking to what was happening across the world, trying to morph that to what we could do locally. Some things that they do in Europe and Africa is different than what we do in the States. The constant and ever-changing landscape of the patients that we dealt with, the different variants, the modalities of treatment that we dealt with, the acuity of patients as each successive wave passed through. All of those were incredibly challenging. And I think, though, the lesson, however, is the same lesson that history has taught us throughout time. And that is that the human species rises and can really accomplish, in the face of incredible adversity. The resilience and the actions that were taken by those in healthcare here in Broward Health, as well as other systems, frankly, throughout the world, it was really nothing short of miraculous.
Right. I agree with you. I think technology is wonderful, but the reality is when it comes down to all this, you have people behind it. And it's the people that made the difference to make things happen. When you didn't have masks, what did you do? The inventiveness of people are amazing. The stories I've heard during that period of time. What would you, if you had to give a piece of advice to the youngins, as I call them, because I'm an old person, but to the youngins, what would that be as a beginning career, as in my, those striving to be a CMO of a hospital, of a system, a large medical group? What would you give them to say, this is what I've learned, and this is a good piece of advice to keep kind of in your back pocket all the time?
I think it would be to constantly challenge yourself. Don't accept mediocrity. Don't do things to be average. Don't do things to just get along or to check off a box or to get a paycheck. Find something that you are excited about doing when you wake up in the morning. It's kind of a shame that probably the vast majority of the workforce of this country gets up simply to get a paycheck and punch a clock. And I've been incredibly fortunate in my career to have found opportunities that have afforded me the ability to be where I want to be and do what I long to do. Taking care of other people is a real privilege, and it's humbling to me every day when I get up as a physician, as an physician executive now, to be able to influence how we care for patients on a health system level is an incredibly fortunate position that I find myself in. And the other thing that I would say is, adversity breeds character. Everything that we go through, the hard times that we go through, really building that level of resiliency, that makes you a stronger person. Don't shy away from the challenges that the world affords you. Well, come at them with open arms and get out of that whatever you can to learn from it, so that you're a much better, well-rounded, more informed person on the other side.
I know there's no such thing as a typical day in a hospital? I've asked that question so many times, and people come back and say, well, Charles, there's really not a typical day in the hospital. I said, but if there was a typical day in the hospital, how does your day start? What do you do during the day? How does it end? What does your life look like in the hospital day by day?
Well, I would love to sit here and tell you that I have wonderful work-life balance, but I think my wife would tell you that I have work-work balance, and my life is sort of in between. I get up somewhere around 5:45, and I get
Oh, so
I have
you
four
get up late.
kids.
So you get up late at 5:45.
That's right. It's a little
A
later.
little late.
Yeah,
A little late. It's a little late.
yeah. I have four kids. I try to get them all ready and dressed for school. I leave the house generally by 7. I'm at the hospital by 7:30. My day generally starts with about a half an hour where I may have an uninterrupted time where I can catch up on emails and some work before the day really gets off and running at about 8. There's a variety of meetings that I'm in, one after the other, interspersed with patient care issues or physician issues, medical staff issues. The phone is a constant anchor that text messages and phone calls ring out. It really redefines the word multitask. When I could be be sitting across the desk from you having a meeting, and somebody pokes their head into the office and talks about something completely irrelevant. When I get a text message while you're still sitting there and the person's still at the door about a third issue, and then the phone rings about a fourth issue while I get an email about a fifth issue. So it really, you have to be incredibly nimble, I think, to be successful. And I hope that I'm doing a good job at trying to manage all of the tasks that come my way.
Before you get to sleep, before the head hits the pillow, what are you thinking about, and how do you get that out of your head, and kind of what keeps you up at night?
Well, yeah. So I mean, I generally try to wrap up my day about 6:30 or 7, kind of officially. But when I walk out the door, and then of course there's the obligatory phone calls that I'm making on the road
Sure.
on the way home. And then when I get home, obviously I try to unwind by shifting and really spending time with the family before they go to sleep, and do the same stuff that parents do with homework and whatnot. Once everybody's asleep and things are kind of quiet before I lay down, I do go over the sort of the pressing issues. How am I going to wake up tomorrow, and what am I going to, in terms of what am I going to try to achieve that day to make Broward Health an even better system than it was the day before? Who am I going to speak to? What meeting am I going to be at where I can leave the day thinking that the day was successful? I don't think that my day is successful merely by having an empty inbox or by having checked off all of the meetings that I went through. I really want to go home and think to myself, if I reflect back on the day, this is at least one thing that I can point to where I can rest my head on the pillow at night, like you said, and say, I made Broward Health better today than it was when I woke up this morning.
And I assume today, or in the last few days, it's easier than it was a year ago or 2 years ago. If there's a young doctor out there, and that young doctor is watching this, obviously not in the middle of the day when he's working, but watching it somehow, and wants to know that one thing in his career path that you've done that could really make a difference and point you in that right direction, whether it be talking with somebody, a course to take, listening, what would it take?
I think it's involvement, and that's a really a huge catchphrase. I mean, I'm obviously involved in many different facets of organized medicine, but I think in terms of involvement, there is a natural connection with other human beings. There is that networking component. Being involved in something as minor as just joining organized medicine, or being involved in a committee or a council at your local hospital or at your county medical society. Just getting to know people. You have no idea. I tell medical students this all the time. You have no idea when you go to a live meeting and you sit next to someone else. You don't know if the person next to you may be your future employer, or that person may be a future partner, or that person can be a network or connection that you could leverage to get a future job. Or maybe that's somebody that you can simply connect with someone else as a conduit. So I think that being involved and networking with other people has really been the pivotal aspect of what has driven my career into what I think has been incredibly successful.
That's great. Wonderful. I appreciate that. And I know we're taking you away from your duties. It's not 6 o'clock yet, but we're taking away from your duties. So I want to thank you again for coming on. Appreciate your support for South Florida Hospital News and Healthcare Report. And I know you've been featured in our newspaper at least a dozen times, if I can count. So I appreciate you taking the time to do this. And we will see you around the hospital in the future. Take care.
Thank you,
Thank
sir.
you.
Real pleasure. Thanks very much, Charles.